The feeling that I got here was so warm.
And then I felt that straight away I knew I'd made the right decision.
We're very supportive of each other.
In many ways, it's just so fulfilling.
It's a very rewarding job.
They were embracing of my previous experience.
In many ways, it's just so fulfilling. I have a real joy about working here. I love it.
It's a very privileged role to have, really, looking after families and relatives at the end of their lives.
The variety and the relationships you can develop with patients and with families.
The autonomy that you have, being able to work on your own, but with the support structure that the Phyllis Tuckwell offers.
I've had a lady this one, I can't thank you enough. I said, but it's my job, it's what I do. It's what I love to do, and I love to do it because I love to give.
Every day is different at Phyllis Tuckwell. If they have any concerns about their loved ones, if they're maybe in pain or if they're worried about something, then we can talk to them and sit down with them and have time to do this.
And that's what I like about the job, is that you have time to do that. You don't have time to do that in other places. And, you know, I like a chat.
If I could dispel a myth about hospice care.
I mean, I get a lot of people say, oh, it must be really gloomy and depressing and sad.
At the Phyllis Tuckwell, that's far from the truth, really. It's dynamic in many ways. There's research going on. It's clinically sound.
It's a really positive environment with really fun, loving staff.
Hospice care is far from being sleepy end of the road nursing. Every day is different. Every day has loads of variety and loads of challenges. We're well supported here, but I find it an utterly creative aspect of nursing.
We all look after each other. There was a great sense of that as soon as I walked in.
It's a very close-knit community at the Phyllis Tuckwell, and I think that's one of the things that's really special about it.
Even though we have different roles, we're all here to do the same job, and that's to help the patients and the families.
The team I work with are never grumpy or boring or uninteresting, but we all get on really well. We love each other, we support each other, and we respect each other.
At Phyllis Tuckwell Hospice, they offer really competitive salary compared to the industry standards, such as the NHS.
The annual leave entitlement at the Phyllis Tuckwell is very competitive. There's 6 weeks a year.
I recently did a European certificate in palliative care, just to improve my practice.
The training is excellent. It's both in-house and we're encouraged to go to conferences and to do courses outside. We're working for a very vibrant, cutting-edge organisation.
If somebody wanted to apply for Phyllis Tuckwell, I definitely encourage it.
Doesn't matter what your previous experience is, what your previous knowledge is, what your previous speciality is, the Phyllis Tuckwell would embrace that.
Definitely come and have a look round, and the moment you walk through the door, you'll get that feeling of wanting to work here.
If I was to sum up my job in 3 words, it would be...
So 3 words.
Satisfying, very rewarding, and I'm happy to work here.
Satisfying, challenging, rewarding.
Happy, satisfying, energising.
Oh, I love it here, I genuinely do.